Welcome back, biology and health students. Today we're going to continue our 3-day discussion of STIs and STDs. Today we're going to focus just on HIV and AIDS. According to the World Health Organization, there's been over 75 million people infected with HIV since the beginning of the epidemic, and over 32 million people have died of AIDS-related infections. Over here, this graph shows you numbers from 2018, so you can see there's approximately 38 million people currently living with HIV, and there is just under 2 million new infections last year alone. So HIV is the virus that causes AIDS. It weakens the immune system by attacking the helper T cells, making it more difficult for your body to fight off future infections. HIV is a retrovirus. So retroviruses are RNA viruses, and if you know about DNA and genes, you know that we take DNA, and from that we make RNA, and from that we make proteins, and proteins are traits. So RNA viruses do the same, but with an added step. So RNA viruses have to transcribe backwards. They need an enzyme called reverse transcriptase to make DNA. And then from there, DNA will make RNA, and RNA will make proteins. The problem with that is that the reverse transcriptase, does not have the proofreaders that DNA does. So every time it's going from RNA to DNA, it makes genetic errors that are not corrected. And so the genetic code of HIV is constantly changing, which is why it has been almost impossible to create a vaccine to fight against HIV, because we're going to try to manufacture a vaccine that identifies these genes, but then the genes change, and so we can't identify them. I'm going to put a video in the show links that you can go to see more of how HIV works. It's super important that we understand how HIV can be transmitted. It can be transmitted through infected blood, semen, pre-ejaculatory fluid, vaginal or rectal fluids, as well as breast milk. This can be transferred from one person to the other either through unprotected sex, sharing needles, through pregnancy, childbirth, or nursing. One of the big importances of HIV education is understanding how it's not transmitted. So from the beginning, there has been a number of myths associated with HIV transmission. For example, you cannot get it from mosquitoes. You can't get it from hugging, sweating, kissing. You can't get it by sharing tears. It's not in any of those bodily fluids. You can't get it from sharing food or beverages. You certainly can't get it from hugging your friend. Many times people don't know of the infection when they first contract HIV. In fact, 1 in 7 people with the virus don't know they have it. A lot of the initial symptoms are similar to any other infection that you would have. Fever, chills, headache, muscle aches, joint pain, fatigue, swollen lymph nodes. Those are common infection signs. Night sweats, mouth ulcers, skin rashes, those are more specific to HIV in particular. Otherwise, nausea, diarrhea, vomiting, that all sounds like the flu. So how would you know if you have the flu or if you have HIV? The only way you would know is by getting tested. I know my students are super interested in what's the difference between HIV. When do you have HIV? When do you have AIDS? So I like this graphic because it shows the progression of the HIV infection. It shows this in 3 separate stages. So you have the acute infection, which I'm going to talk about now, and then the chronic, and finally AIDS. So notice this graphic here. These are your T cells, your helper T cells, the blue ones. So one of the things I can see as the disease progresses is the numbers of my T cells are going down. Here's where I came into contact with the infection, and the little red balls are considered your HIV virus. So here you can see a viral load, and then it kind of backs off for a little while before it starts building up again until we have a ridiculous amount of virus in the blood. So the acute infection is the earliest stage. That usually lasts about 2 to 4 weeks after the infection. That's when you're going to have all those cold symptoms like the flu. What you see happening, the HIV levels in the blood are increasing, and the risk of transmitting the HIV infection is very high. So when your viral load is high, it's very easy for it to be passed on. If you start antiretroviral drugs at this stage, you can have huge benefits in keeping your viral level to a very low number. So as it progresses, we move into the chronic phase. So this is the same graphic, but I'm just narrowing in on the piece I want to talk about. So as this virus progresses, HIV multiplies in your body, but it's multiplying at very low levels. Notice the numbers here are much less than my initial level. People may not know that they have HIV at this time. They may not have any HIV-related symptoms. If you are taking antiretroviral drugs, ART, you can stay in this stage for several decades. Before the antiretroviral drugs, the disease progressed very quickly. And if a person was not able to receive these drugs, their disease would progress much more quickly. So maintaining that undetectable viral load decreases the risk of transmitting HIV. So it's super important to lengthen your own life as well as protect the people around you. So finally, we reach the third stage, which is AIDS. So autoimmune deficiency syndrome. At this point, the immune system is severely damaged. Notice I have just a couple T cells left, and the T cells are needed to alert the body that there is an infection. So without that alert, the body will succumb to many opportunistic infections that we normally wouldn't get. Many cancers, tuberculosis, even animal diseases. So diseases that we normally don't have an infection, we normally are immune to, because we're losing our immunity, we are susceptible to these animal diseases. So at the point that our CD4, that's our helper T cells, at the point that our count is less than 200 cells per microliter, that is like a quantitative measurement that diagnoses a person as having AIDS. You've moved from being HIV positive or having HIV disease to having AIDS. Also having one or more of those opportunistic infections, and also the viral load is very, very high, and at this point it's very easy to transmit HIV. So AIDS is acquired immune deficiency syndrome. It's also sometimes called late stage. You probably know AIDS as acquired immune deficiency syndrome. It's also considered late stage HIV. So a syndrome is when you have a set of symptoms, not just one identifying symptom, but there's a number of symptoms involved. So it's a set of symptoms and illnesses that develop as a result of advanced HIV infection, as we saw in that progressive graphic. This destroys the immune system by taking out your helper T cells, and the helper T cells are supposed to alert both your B cells, which make antibodies, and your killer T cells, which destroy infected cells, that there's an infection in the first place. They're the cells that check out all the things in your body and they say you belong or you don't belong. So without our helper T cell, we can't identify the things that don't belong. So commonly you'll get things like thrush, which is a fungal infection of the tongue, and I have a graphic of that here. Skin problems, blotches, lesions, and sores are common. Kaposi sarcoma is a skin cancer that is identifying of AIDS, I believe. Extreme weight loss, so this is called HIV wasting. So people who develop AIDS now, more and more people are staying in those first two stages of AIDS. specifically in that chronic phase where you can keep the viral level low and not risk transmitting the virus. Less and less people are advancing to the third stage to AIDS because we have better and better medications. So many less people today than even 10 years ago are progressing to that end stage. So how can you avoid contracting HIV? HIV is difficult to treat, needs lots of medication and a very regimented schedule, but it's easy to prevent. And let me state the obvious. Abstain. Abstinence never fails. It's the only 100% way to protect yourself from HIV or any other STI. Now, that's probably not realistic for everyone watching this video. So, if you do have sex, always, always, always use a condom and use it properly. Talk to your partners about their sexual history, because remember, whoever they've had sex with, you're indirectly having sex with that person as well. Never share needles or inject drugs, and always get tested and treated for sexually transmitted infections. In yesterday's discussion, we talked about how some infections make you more susceptible to HIV. So if you have another STI, get treated before having any more sex. There's also a PEP. PEP is a post-exposure prophylactic, and that you can take that if you suspect you have had exposure. So if you know that you had sex with somebody who has HIV in the first 72 hours, PEP can work very well for you. PrEP is another new medication out that protects high-risk individuals. So maybe somebody who has a partner who has HIV. They're going to be a high-risk individual, and so they can take one of the PrEP pills. So because I like the science of things, I like this graphic because it explains a little bit about how HIV works as well as how PrEP works. So this is an example of HIV. It infects one of your T cells. HIV is a virus. It's got a protein coat. It's got RNA on the inside, and that's it. It's not a living organism, and it can't reproduce on its own. It needs your cell's machinery to do it for it. So it infects your cells and incorporates its RNA in with your, actually it makes copy of its RNA into DNA, and then its DNA gets copied into your DNA. So it tricks your cell into making more viruses for it. You're doing the dirty work. So you make a bunch of HIV viruses, which bursts your helper T cells, which lets all those viruses loose in your body. And they go and they infect other T cells and do the same thing, trick it into making more HIV. So Truvada works like an interferon. So interferons, they interfere with viral reproduction. So it's kind of like that in that one cell produces this chemical that affects the cells around it and protects the other cells. So in this case, it's a medicine, and it's creating like a shield because HIV has to dock with a receptor on the helper T cell in order to gain entrance into your cell. So this Truvada puts a shield on the outside of your helper T cell, so then it blocks the binding site so it can't get access into your cells. So then that would cause the HIV to be repelled. With new focused efforts on teaching people to live with their HIV, teaching people to get tested. 45% of Americans have never been tested. To get tested and get on treatment right away has greatly reduced the number of new infections that we have had over time. So back in 2000, where we might have just educated people on avoiding HIV, we had 2.8 million new infections. But now, teaching people to live with their infection and to treat it so that it's not transmitted to others, the numbers are decreasing drastically with only 1.7 million new infections last year. So the target by 2030 is to have less than 200,000 new infections, and that is an awesome goal. This might seem repetitive, but I'm going to keep drilling it. If you're sexually active, get tested. It only takes 30 minutes or less. And there's many different types of tests, and I could go into them, but I'm going to save our time and not go into all the specifics. But basically, the only way to know if you have HIV is to get tested. You want to get it during that first or second phase, right before it progresses. We want to get on antiretroviral drugs ASAP to extend our life and to decrease our chances of passing the disease on. The CDC recommends that individuals between 13 and 64 are screened at least once. So get tested, get treated. HIV can lead to AIDS, but it doesn't have to. The treatment protects and improves the immune system, keeps your T cells high, keeps your viral level low. It prevents secondary infections, so those opportunistic infections. It lowers the chance of passing HIV on to others, and it leads to a longer and healthier life. And if a woman who is pregnant and she has HIV, if she's pregnant and starts these medications, the chance of passing HIV on to her baby are 1% or less. The treatments work. So here is showing you the detectable load, and then with medication, the undetectable load. So if your viral load is undetectable, you cannot pass it on to someone else, or the chance of you passing it on to someone else are much, much lower. And what do we have because of these wonderful drugs? Back in 2000, we had 1.4 million deaths in that year. Last year, less than a million. We had 770,000. So again, the target for 2030 is less than 400,000. So with better diagnosis and increasingly better treatment, HIV/AIDS is no longer the biggest cause of death in Africa, which is where it was hit the largest. Rules to live by. Diagnose your HIV as early as possible. Get tested at least once a year. Treat your HIV quickly and effectively. The sooner you get tested, the sooner you can get on antiretroviral drugs. Antiretroviral drugs will protect you from letting the disease progress to the point where you are getting opportunistic infections. It will also protect the people around you because it'll keep your antiviral level low so that you have less chance of passing it on. So do your part in reaching our 2030 goal. Prevention. Talk to your partners. Use abstinence. Use condoms. Know your status. Get tested. Get treated. Treatment keeps your viral load undetectable. If it's undetectable, you are much less likely to pass it on. And that's how we get our numbers to go down. Do your part, take what you learned, and pass it on. Thank you.